Hi, again, my name is Cyndy Comerford, and I work at the San Francisco Department of Public Health. I work in the Environmental Health Branch, and I manage planning and policy. And today I'm going to talk about how the Health Department has been using open data, specifically civic data standards, to improve public health. Data standardization is a really critical milestone that needs to be better understood and advanced across cities to understand the full potential of open government. So for those of you who aren't familiar with data standards, some of the common past data standards include LIVES, which is for restaurant inspection scores, Open 311, or GTFS, which was for transportation data. Today I'm going to talk about the House Facts Data Standard. The House Facts Data Standard was a collaboration between the City of San Francisco and Code for America, which composed a uniform reporting data standard for the health and safety of residential housing. The data set contains the locations of buildings and the owners, all of the inspections of these buildings, and all of the violations that might have resulted from these inspections. So in San Francisco, there's 3 agencies that are responsible for residential code compliance. It's the San Francisco Department of Public Health, the Department of Building Inspections, and also the Fire Department. So because of this data standard, for the first time, we've been able to aggregate 3 different data sets to begin to visualize some of the issues with housing in San Francisco. So the pie chart on your right shows all of the data violations for the past 5 years by department, broken down by violation type. And the map on the left shows this data aggregated at a parcel level, so we can begin to see hot spots of violations, and we can begin to see some insight into some of the housing issues within San Francisco. One of the first benefits of this housing data standard is that now the city can begin to use this as a tool to allocate resources to improve strategic planning around health and safety of housing. One of the reasons the Health Department got involved in this data standard was because of the impact that housing has on your health. A safe, hazard-free, affordable home is like a vaccine. It keeps us healthy. The Health Department has used this data and open data standard to raise awareness about the 6 million US families that live in substandard housing, and as a result, suffer from significant illness, injury, and death. Injury and illness from substandard housing in the United States cost the nation $55 billion on an annual basis. And in San Francisco, a recent study has found that over 53% of the homes have at least one health housing problem. So we've been using this data to educate the public about the health impacts of housing. Our Department of Public Health, like most departments of public health, do not maintain, build, sell, or design housing. So in order to have an impact on housing, we have to collaborate with other partners that are more directly involved with the housing sector or with open data. And through our collaborations with Code for America, we have formed some very unique partnerships. We partnered with a small San Francisco-based startup company called Appalicious to create a mobile app called Neighborhood Score. And this utilized the House Facts Data Standard to create a health and sustainability score block by block in San Francisco. We have also partnered with Trulia. Trulia is an online real estate agency, and they have taken the data from our standard, and they're going to integrate it into their online real estate listings, so consumers can get more information about the housing that they're about to purchase or rent. So how do we develop a framework and measure success of this data standard? So on a national level, over time, clearly, it's how many cities adopt the standard. For the Department of Public Health, it's how successful we are about raising awareness about the health impacts of housing and how we can increase code compliance. We want to see whether we're able to reduce negative health outcomes related to housing, such as ER visits. And lastly, how we can form partnerships to get this data into the hands of citizens. So this process has not been without its challenges. Data standardization has some of the same challenges that there are in the open data movement. We had 3 very different city agencies with 3 very different data management practices. No real city resources, and I don't want to say lack of a clear mandate, but a fuzzy mandate. And what I've learned through this process is not just about how to make friends and get them to give you your data, but it's as we as government designing systems that are conducive to collecting data and making the data open through publications, that we're able to build systems that support sustainability and accessibility. And it's about data management practices and releases. So although we've had some challenges, we have seen some initial indicators of success. Thus far, we have 3 cities that have implemented this data standard, and we have approximately 9 more who are committed to getting on the standard within the next year. We have seen this data, health and housing data, as a high-value data set. And I know that there are many other data sets out there that we can use to prevent diseases and also the causal factors like substandard housing. If we looked at our San Francisco Open Government Portal, we can see that public health has been searched 80,000 more times than the second most searched term, which is parking. This, to me, is an indication that we need to move beyond parking apps, sorry, and start using data to reduce negative health impacts. Will data be our next vaccine?